So joining me for more on this is Dr. Omer Awan, professor at the Maryland's School of Medicine. Dr. Awan, thank you so much for your time today. But I want to start because, I mean, this seems like it marks a major shift in how previous administrations have operated compared to now. But what are the implications here?
Thanks for having me, Alex. This could really have devastating consequences when you consider what the World Health Organization actually does. You know, the World Health Organization is responsible for coordinating disease surveillance. It sets vaccine standards. It's responsible for sharing transparent data among countries throughout the entire world. So when the United States withdraws from the WHO, that risks delayed information and important responses from infectious diseases. So things like Ebola, Mpox, and even the flu. And the flu currently, remember, is surging here in America. I mean, we have nearly 18 million Americans that have had the flu, and over 9,000 Americans have died, which includes 32 children. So this is not the time for us to be withdrawing from the WHO. If anything, we should have increased surveillance and increased participation in many of these important global health initiatives.
Well, can I ask you, I mean, what was the administration's reasoning for this?
Well, the reason they cited it is because they felt that the World Health Organization mishandled the COVID-19 pandemic. They also thought that there was undue political influence with the World Health Organization. But while the World Health Organization may need some reforms, the answer isn't to just leave. I mean, I would think that we would want to reform it and to work together so that people can stay healthy. I mean, we're talking about safeguarding the health of the world and even Americans. And when we leave, Americans suffer because our health is at stake here.
Yeah, well, and lastly here, I was reading that the U.S. owes the World Health Organization some $260 million in fees. So how would this work?
Well, that's what they owe. The United States owes about $278 million to the World Health Organization. I'm not sure if they're going to pay it, but remember, the United States is responsible for funding 17 to 18% of the World Health Organization's annual budget. And that translates actually to billions of dollars across years. And this has helped fund life-saving vaccines, for example, to many individuals, particularly in low-income areas like Africa, Southeast Asia. And this has prevented deadly diseases and has saved millions of lives. So when the WHO doesn't get these funds, then people are going to die. That's literally what's going to happen. And people are going to succumb to important infectious diseases like measles, polio, for example. So these are just some, not even all, but some of the devastating consequences that will occur because of the U.S. withdrawing from the World Health Organization.
All right, Dr. Awan, I appreciate you. As a physician and senior public health contributor for Forbes, Dr. Awan, thanks again.